Hello, good afternoon guys. Welcome to MK Convenience Brokerage. My name is Mohammed. In this video, I'm going to show you a sample course descriptions and courses from the Center of Disease Control and Prevention. So this is about the Malaria 101 for the healthcare providers. CDC offers continuing education courses for those of you that want to take courses, especially for those people that are planning to become doctors, nurses, healthcare providers, anything with health related field, or even if you're not in a related field, you may still take the courses. It's free, they don't charge you. That's the best thing about the Center for Disease Control and Prevention. They're offering you courses and knowledge for free. So these are some of the sample course questions that I wanted to show you. I'm going to read through some of the questions and I'm going to show you what type of questions are so you have a better understanding. If you do plan to take the classes, you'll know what I'm really talking about. Knowledge check. When a patient represents with suspected malaria, what is the best method to diagnose malaria? The answer is A. Thick and thin blood smears. Question 2. Which question should you ask a recently returned traveler who presents with fever? All of the above. Where did they travel? Did they take malaria prophylaxis? Did they adhere to malaria prophylaxis regimen? What symptoms are they having? 3. What are the key pieces of information necessary for management of malaria? The answer for that is E. All of the above. Species of malaria, percent parasomia, symptoms and signs of severe malaria, possible drug resistance. 4. What drug regimens are recommended for treatment of severe malaria? The answer is E. A and B. IV quinine and doxycycline, and B. IV estrogen followed by doxycycline or clinidamycin or malorine or malquine. Of the following, who is at risk for exposure to malaria? All of the above. Person traveling to malaria academic area to visit friends and relatives. Business traveler to malaria endemic area who will be staying in an air-conditioned hotel. And tourists going to resort or malaria endemic area. Measures that a traveler can take to prevent malaria include using mosquito repellent, wearing protective clothing, sleeping under an insulated threaded net, taking chemoprophylaxis, getting immunization. Oh, I'm sorry, except E. E is not in part of it. A 25-year-old man comes to a clinic for pre-travel consultation. He plans to go on the Honduras to work on a research project for 2 months. He has no significant past medical history and allergies. He prefers a daily medication and leaves in 3 days. Other recommended medication and prophylaxis, atomaquine and proguanil, doxycycline, or primaquine could be used. Is true or false? Well, the answer is true. Proguanil is a contraindicated in those with glucose 6-phosphate dehydrogenase and deficiencies. A 35-year-old woman comes to clinic for a pre-travel consultation. She says that she plans to backpack around South Africa for 1 month. What other questions should you ask her during the pre-travel consultation to help you determine what medication, if any, is needed for malaria prophylaxis? The answer for that is F. What is a specific itinerary within South Africa? What is her medical allergy history? Where is she? When is she leaving? Does she prefer a daily or weekly medication? Malaria is caused by, the answer for that is C. Parasites. Malaria is transmitted, the answer for that is F. A. Through a bite of an anopheles mosquito. B. Through a transfusion of infected blood. And C. Congenitally from mother to child. Which of the following statement describing where malaria occurs is correct? The answer for that is C. Malaria is widespread over 100 countries. Which of the following statements regarding malaria in the United States is correct? The answer for that is all of the above. Some criteria for severe malaria include all the following except. The answer for that is nephrotic syndrome. Preventing malaria in the United States, how can you prevent it? Well, for travel to malaria endemic area, chemoprophylaxis and personal protection from mosquito bites, such as bug spray and stuff like that. That should be able to help you prevent the malaria. Again, this is a post-test clinical outreach and communication activity. A lot of times, when you take the test, they give you a post-test. Like, for example, influenza antiviral medication recommended for which of the following? Influenza antiviral drugs should be given to infants due to possible side effects outweighing benefit. The clinic should wait for confirmed laboratory confirming of influenza prior to starting antibiotic treatment. These are post-tests, and then you'll get the real test. Well, basically that's about it. Thank you again, guys, for watching this video. Hopefully you guys enjoyed it. If you guys have any other questions, comment, concern, please comment, like, subscribe. I'll try my best on my part to help you out as much as I can. Thank you again, guys, for watching this video, and hopefully you guys enjoyed it. Thank you.